Hello everyone, this is Veena Kaustuban. I'll be presenting on the topic of characterizing continual learning scenarios for tumor classification in histopathology images. There are two main challenges associated with developing or building a model the traditional route in digital pathology. As data volume continues to increase, it would become impossible to train with all of the data from scratch. Continual learning aims at addressing this by mostly training the model with the most recent batch of data. The second challenge is if newer data batches come from shifted distributions relative to past data, conventional methods would require iterative training and updates. With continual learning, irrespective of data shifts, the model can be trained with mostly the newer batch. Continual learning helps make the model more flexible and adapt the model to evolving patient data. Imagine a model trained originally with batch 1, shown here in solid circles with a dashed line representing the learned class boundary. When evaluated on a newer batch of data shown here in open circles, the class boundary is no longer accurate. With joint training or training from scratch, we pool the data from both batches and retrain the model. The updated model now classifies all of the data as expected. In transfer learning, the initial model is fine-tuned with data batch 2. It can now classify newer data correctly, but is no longer accurate on batch 1, a phenomenon called catastrophic forgetting. Continual learning balances out joint training and fine-tuning. It helps the model learn characteristics of the new data while not forgetting about those from batch 1. The method shown here stores representative examples from the previous batches and replays them while learning new tasks to alleviate forgetting. One of the main use cases of continual learning is where there is a shift in distribution between batches of data. In digital pathology, these shifts could occur from varying image digitization conditions or image sources. We manually simulated these data shifts, divided the entire dataset arbitrarily into 5 subsets. We kept one subset unchanged and called it domain 1. For the remaining subsets, we performed stain and mixing, applied different augmentation settings, followed by remixing. As you can see, the shift or the change between domains is in different columns. The images were qualitatively assessed by 2 pathologists as well. Depending on what the differences are between data batches, a continual learning problem can be framed differently. There are 4 relevant scenarios that we have identified. We illustrate the scenarios with a tumor classification example. The first is data incremental, where newer data is similar to the old data and comes from similar distribution. It's just an increase in data volume and the model needs to continually learn on newer examples. The first iteration of the model, V1, is trained on 2 classes. With more data coming in with the same 2 classes, model V2 is trained mostly on the new batch. And this can be repeated for any number of update steps where the model is trained mostly on the latest batch of training examples. The next is domain incremental. Here we describe a scenario where newer data comes from different distribution than the old data, as in different data sources like I previously described. Thus, the model continually learns from an increasing number of domains. B1 is trained on data from the first source. In the next iteration, we introduce data from a different source, for example, collected from a different stainer, and update the model with just data from the second source, and keep adding data from different sources at each iteration. Class incremental scenario is where newer batches of data have classes the model hasn't been trained on so far. That is, continually learning from an increasing number of classes. B1 is trained with a batch that has only tumor and normal classes. In the next iteration, there's newer data that has 2 new classes. So the model continually extends to new classes at every step. The last scenario is task incremental, which requires additional information in the form of a task identity or a task ID. I'll briefly go over different categories of continual learning methods. They can be divided into 3 families. Irrespective of the family they belong to, the intuition is to learn new skills or information without forgetting what has already been learned. Regularization methods have an additional term added to the loss function to consolidate old knowledge aimed at reducing forgetting. Replay-based methods store images, representations, or prototypes in memory and replay them when learning new tasks to alleviate forgetting. Parameter isolation methods involve using different model parameters or different parts of the model architecture for different tasks so that knowledge associated with a specific task is unimpacted. Listed on this slide are methods we tested and compared with baseline in our work. AGEM and COPE here are online methods. We evaluated accuracy on past, current, and future test data sets as a way of evaluating the following metrics. Forward transfer, where we evaluate performance on current and future data batches to see how well the model assimilates new information, and backward transfer, where we evaluate on past batches as a way to quantify catastrophic forgetting. We want to make sure that the 2 are balanced and one is not improving at the cost of another as much as possible. We compare the continual learning methods against offline and online baselines. Joint training is considered the upper bound baseline, whereas fine-tuning is the lower bound. On the right are accuracies we got at the end of training. The box number represents the method that gave the highest accuracy. A dashed box indicates the method outperformed the upper bound. The three sections are offline methods, AGEM and Co. To summarize the results, though LWF outperformed the upper baseline in data incremental setting, continual learning on the whole is most effective for the most challenging class incremental scenario. ICAL is the only method which performed much better than the lower bound. And overall as well, ICAL has the best accuracy. We found task incremental to be more challenging with digital pathology data compared to other domains. Experience refers to training the model on a batch of data. The figures on this page shows the accuracy across experiences when the model is evaluated on all of the test data. The takeaway here is that continual learning methods show good forward and backward transfer, with the exception of class incremental and to some extent domain incremental scenario. Once again, ICAL is the most effective across scenarios. In summary, we proposed continual learning scenarios relevant for digital pathology, characterize the performance of recent continual learning methods with a specifically designed simulated dataset. Thank you.